I am going to jump straight into it today. Welcome to the pregnancy series, training modifications and considerations for trimester 3. So today I'll be talking about pregnancy training, but more specific to what modifications we may need to be making now we're moving through trimester 3. So I myself am in trimester 3, and I can speak from a relatable standpoint, but also just from a, I suppose, safety and guideline standpoint as well. So when we're moving into trimester 3, there are a few things that are going to be carried over from trimester 1 and 2, and more specifically, symptoms that will probably just be exacerbated. So you'll be actually feeling that little bit of extra fatigue, that little bit of, extra off balance, potentially really starting to get the pelvic girdle pain, which is like that sort of really sharp or dull ache. And this can come and go throughout the day. So I'm just going to talk first on intensity, what that can look like, and where we may need to, drop it back if we're doing it or if we do. So again, I am speaking on general and low risk advice. So this is specific to any women who are a low risk pregnancy and they're able to continue to train. I completely understand that not everybody has got the privilege to be feeling well enough to continue to move. So it's just about what you are able to work with and what you are able to manage. So coming into trimester 3, what we want to do is just lower the RPE. So you don't want, again, like I said, we don't ever really need to be pushing to RPE of that max 10 when we are pregnant. So we can bring it back down to around a 6 or 7 coming into trimester 3. And taking trimester 3 as a bit of an approach of what's important is that should be how your sessions run. So trimester 3 is important to focus on mobility. Again, just really thinking about reducing that ab separation. And when we're speaking about the ab separation, it's going to happen. It is inevitable. Everybody who is growing a baby, you are going to see some separation of your abs. Hey, Bree. And just to talk on that a little bit further, that is the linea alba, which is the connective tissue between the abs. And as our bellies start to grow to make rooms for the babies, then that connective tissue up here is going to thin out and it's going to stretch. So that is how, that's the ab separation, and that can be determined during pregnancy, but also post-birth. So this is really important to get checked, just so you know, basically the level of ab separation, and then you can know the level of recovery or rehabilitation that is needed post-birth. Speaking a little bit more today on pelvic floor as well. So there's a few sort of modifications that we do want to take into account when we're speaking about pelvic floor. Remembering, especially during any weightlifting, there is that's already quite a stress on the pelvic floor, the diaphragm. So if you are pregnant, then there are some things that we definitely need to take out. And the Valsalva maneuver or Valsalva breathing is definitely one of those, because it just creates far too much intra-abdominal pressure that is actually going to be causing that additional load on the pelvic floor. Now, as we're moving into trimester 3, especially, and for some people, I know myself, I felt like quite a heavy pelvic floor during basically from the very start of trimester 2. So I started to adopt trimester 3 modifications quite early, just to maintain that level of pressure and being able to actually control the lift. And that is super important, not only for your pelvic health, but also for your abdominal health as well. So talking about the pelvic floor and some modifications that we can make are going to be, number 1, first of all, we need to make sure that we're able to work on the breath. So whenever we're adding load, then there is always going to be that additional stress on the pelvic floor. So if we can make sure that if we're able to manage core control, manage the breath during the lift, then that is something that you can continue to load. If you feel additional pressure through the pelvic floor during a lift, then that's where you want to make some modifications. So number one, being that breath, obviously we've already taken Valsalva breathing out. We want to make sure that we actually contract the lower abdominals. So we want to think about basically pulling the abs together on that exhale, zipping up through the pelvic floor where you can feel that it is, well supported before going into the lift, okay? And then from here, you want to inhale on the descent. So inhale as, I'm speaking in a squat terms here. You can probably, if you're not actually watching the video, inhale as we come down, and then we exhale as we push up. So we want to be able to make sure that we can maintain that level of support through the pelvic floor by creating the connection, inhale down, exhale up on the exertion. Now, if you feel like you still are unable to, or if you still don't feel quite supported enough during that, and this can change from day to day, it can change from, one day you may be able to continue to squat with, 15 kilo dumbbell. To the next day, you may start to experience either some low back pain, some, additional leakage or discomfort or heaviness the next day when you try to do it. And all this means is we need to be listening to our body and the responses that it is trying to tell us and modify as needed. So again, this is why, like I spoke about last week, it is all very contextual to everybody's individual circumstances. And this is why it's important to know what red flags to look for and to know what considerations, modifications you can make along the way. So as an example, if you, like I said, you were able to do your 15 kilo dumbbell one day doing a squat, but then the next day or the next week, you're actually not able to without experiencing some leakage, then what you want to do is just dial back the load. So this is where we will continue to focus on that contraction, continue to focus on the breathing, but dial back the load that you're actually applying to the lift. So there are some bigger compound lifts that now in trimester 3, we do, it's just that risk versus reward, right? So we do just, my personal opinion is just to take them out. So things like a sumo deadlift, even a low bar or sumo squat, anything that is quite a wide stance is also going to make it a little bit trickier to maintain that pelvic floor contraction and feel supported. So we want to reduce not only the load when you start to feel that pelvic floor heaviness or the lack of, I suppose, support, but you also want to start to reduce the time under the load. So that can be done through volume. So number of sets can start to be reduced, number of reps as well. So instead of going for a loaded set of 12 reps, you might just do a loaded set of 6 to 8 reps as an example, because the whole purpose of training during pregnancy is to maintain mobility, continue to work on your balance, and have some strength to support your postpartum journey. So if we just keep that in mind, we don't need to be chasing those PBs. We don't need to be loading up the bar where we're walking out of the gym sore or even experiencing DOMS the next day. It's about some maintenance, and it's a really nice place to be if you're able to maintain that movement. So that would be if you're experiencing any pelvic floor heaviness, the first thing is obviously going to be to work on breath, the contraction, and then reducing the load, okay? If you have then reduced the load and you are still experiencing some leakage or some heaviness or not feeling supported or, pelvic girdle pain or anything like that, then what we want to do is reduce the depth. So instead of working in a large range of motion, so as an example, if we are dropping to a squat and we're getting our hips below our knees, then what we want to do is just reduce to 90 or higher of a squat. So we're not actually dropping our hips quite so low, because the lower we go, then the more pressure we will be applying to our pelvic floor and to our abdominal region. As you think about it as well, you want to just make sure that you're applying as much effort as needed for that activity. So what I mean by that is, if you are, just bending down to pick something up, we don't bend down and really strain and put that extra pressure through our trunk area. We bend down and we pick it up. So same needs to be applied to your training. So we need to make sure that we are able to breathe through the lifts and apply the amount of effort needed to execute the training. Because if you are, like I said, say you're doing bicep curl and you're holding your breath and you're really making it and trying to, bring up these weights that don't necessarily require that amount of pressure to be added, then it's additional stress added to the pelvic floor that isn't necessary. So that's a really important thing to focus on as well. Now, coming into trimester 3, we really want to just adjust or modify anything that is causing any pelvic girdle pain, which it can be, that sort of sharp feeling or that dull ache over the day. If you are experiencing pelvic girdle pain or SPD pain, then it is definitely something that you want to go and see a pelvic health physio about, especially if it's something that you are feeling and experiencing on a regular occurrence. If it's just a day-to-day thing and it's happening all the time, you definitely want to go and get that checked out by your pelvic health physio. And then the other thing that I suppose I wanted to sort of touch on is just going to be about using trimester 3 almost as a habilitative program, okay? So rather than going, okay, I'm done, I'm not able to lift heavy in the gym anymore, I don't feel like doing, anything other than that, then try and take the approach of, okay, the maintenance that I can do right now is really going to support me postpartum. So what I mean by that especially is going to be around your ab separation. So when we're talking about, like I've mentioned through trimester 1 and 2, we are still able to maintain some core training. So during trimester 3, we want to make sure that we're able to you're not going to be able to avoid ab separation, but we want to be able to reduce the effects that growing a baby has, okay? Because then that's less rehabilitation on the other end. So what we can do is making sure that we are practicing connection breath when training or when lifting or straining during everyday life. Making sure that when you are doing some training, you are actually incorporating some core work. Now, when we're going to core work, we've already spoken about, we take that crunch away, but you want to think about, okay, so in what other sort of dimensional planes can I work my trunk? And I have got a video on this. So if you are, pregnant and looking to continue to maintain nice solid core, then let me know and I can pass that on. But a few things that you can do is going to be like the farmer's carry. That's a really great stabilizing exercise. And also the pull-off press, which is also really great for just stabilizing your postural muscles and maintaining things when we're doing things such as, bird dog or cat cow or things like that. When we're in a tabletop position, just make sure that we're not actually holding too long. So when let's say we are doing, say, a bulldog hold where we're on all fours, tabletop position, we're going to be holding there. That is going to really create that stabilization and make you work, but we don't need to be holding 30, 40, 50 seconds because that's just then adding additional pressure. So again, that's what we want to focus on in trimester 3, is just reducing the amount of pressure because it's already there like all day long, right? And then, so we still want to be keeping some core training in, definitely needs to be modified. The last thing that this takes me into is when training or when moving about your day, a few things to look out for. So if you haven't already heard of coning or doming, I briefly touched on it last week, but that is basically where that, like I spoke at the start of this, the linea alba, so that connective tissue, it is quite stretched or loose. So it can't actually support those core muscles together, right? So let's say you're lying in bed and you go to sit up and you see there's actually like a cone or like a little bit of a doming shape coming from your belly, that means that linea alba has been stretched and it's so thin that it's not actually supporting the core. So that's what you need to look out for. Keep an eye on that coning or doming. This is when, if you are training, it's a really great idea to train in either a crop top or, if you're not comfortable in that, just a really tight singlet, something that you will be able to see that shift in, that shape shift basically in your belly, and keep an eye on that. Now, if that does happen, we do need to make modifications. We need to, again, basically reset the lift or reset the exercise you're doing, work on that connection breath. Again, try and pull that contraction on. So we're going to try and close our rib cage down together, keeping our core together. Then try the exercise again. If continued coning or doming appears, we need to reduce the intensity, meaning reduce the load or reduce the range of motion that we're working in. Now, again, if you are applying the right amount of effort to the exercise, then we should be able to decide from that, do I need to, can I maintain this exercise or this load without the coning or doming, or do I need to modify? Now, if you do need to modify, then we want to, by all means, if it's say a plank position, then you want to remove planks from your toes and drop to your knees. Again, trimester 3, we're probably not doing planks on our forearms anyway, and if we are, they are very short holds, and they are broken down into a hold, a release, hold, a release. And if you're doing your side plank, again, you still need to think about zipping baby up and in and drawing those hip bones together to really, it's a really solid, conscious effort to keep that core nice and strong, or as strong and together as you possibly can. So that's what I wanted to basically cover, the importance of continued maintenance during trimester 3. Potentially it's not called training because we're not going to specific heights or anything like that, but really focusing on keeping an eye on the coning or doming, because the more often that's happened, then that is a telltale sign that that linea alba, that connective tissue, is actually thinning out, and it is going to take more rehabilitation on the other end. And just, I guess I want to wrap this up with the way that I've really approached trimester 3 is going into it with, okay, my body is actually about to go through a marathon, because giving birth, you don't know how long you're going to be, in labor for. You don't know what kind of, potentially there's so many unaware unknowns. So take it as a time where you're not actually applying additional stress to your body, and you are giving it the rest, the nutrients, and allowing your body to relax, remembering that during birth, to really give you and support your birth, being able to relax and let your body do what it is designed to do is going to support the outcome. So you really want to, you don't want to be building up lactic acid. You don't want to be, stiffening or tightening muscles when you don't need to be. We want to be going the opposite way. We want to be relaxing. We want to be able to take on a more of a maintenance approach than a training approach, is what I'm trying to kind of say. So I hope today gave a little bit more deeper insight into the training while pregnant. If you do have any questions, of course, please pump them my way.